From Microbe TV, this is Beyond the Noise, episode number 3, recorded on May 29th, 2023. I'm Vincent Racaniello, and joining me is your host, Dr. Paul Offit.
Thank you, Vincent.
Happy Memorial Day, Paul.
And to you, too.
This is the video version of Paul's column on Substack called Beyond the Noise, cutting to the chase on important health topics. Today, I'd like to take a closer look at Paul's post called, Do We Still Need COVID Vaccine Mandates? So let's start, Paul, by reminding us when COVID vaccines were mandated and why.
Sure. So COVID vaccines were first authorized in December of 2020. And at the time, we didn't really have an infrastructure for mass vaccinating adults. That had to be put in place. And so we did. We figured out how to mass produce, mass distribute, mass administer vaccines so that by March, April, we were vaccinating 2 million people a day, 3 million people a day. And so that by the time we were in April and May of 2021, we had about 70% of the population that was vaccinated. But if you looked at who was getting hospitalized and who was dying from this virus, it was people who had chosen not to vaccinate themselves. And so what got put in place very early then in 2021 were vaccine mandates. Now, in a better world, you shouldn't need mandates. In a better world, people would look at the data and say, here's a virus that's killing us, that's changing the way we live. Here's a vaccine that's safe and effective. I'm going to get the vaccine. But nonetheless, there were 30% of the country that chose not to get it. If you looked at who was getting hospitalized, these were the people who were getting hospitalized. It was really frustrating. And the purpose of mandates at that time was to flatten the curve, meaning to decrease hospitalizations so that we could go about our business in the hospital and do what we were normally doing, like elective surgeries, which we stopped doing at our hospital because we were so overwhelmed with this virus. And so that's why those mandates were put in place. I mean, I remember there was a family that came into the hospital sort of mid-2021 when the vaccine was already authorized not only for children over 16, but for children over 12. And here was a boy who was clearly struggling to breathe. He was a teenager. He wasn't vaccinated. His parents weren't vaccinated. His siblings weren't vaccinated. This was an avoidable problem. I mean, in medicine, there's so much we can't know. There's so much there's so much we don't know. There's so much we can't do. This we knew. And when you watch people rejecting it, it's hard. We shouldn't need to mandate it, but that's why we mandate it. So now fast forward to today, things are different.
So, Paul, at what level were the mandates? I know educational institutions, hospitals, and so forth. Was it at a state level? Was it at a federal level?
Mostly, there was a federal vaccine mandate for federal employees, but mostly that happened at the local levels, at bars, restaurants, sporting events, hospitals, businesses. It was at the local level. That's where it was most effective. I remember one family actually that came in, and again, the child was pretty severely ill. The mother wasn't vaccinated. The father was vaccinated. And the siblings weren't vaccinated. And I asked the father, how come you got vaccinated? And he said, because I had to for work. So they do work at some level. You shouldn't need them, but we do need them sometimes.
All right. So today, are most of the mandates lifted at most places?
Yes, I think today mandates are gone. When I wrote that column, I wrote it because there were still a handful of schools that required a booster dose to get onto campus. And I thought that was not sensible. And I'll explain why. We in September of last year, the CDC recommended a booster dose with the bivalent vaccine for everyone over 6 months of age. Now, that was really contrary to their data, because if the goal was to prevent hospitalization, their data, the CDC data, showed that those who most benefited from that bivalent booster were those who were elderly, specifically elderly, like over 75, people who were immune compromised, people who had multiple comorbidities. That was also true with UK data. So I never quite agreed with that. But to take it a step farther, there were a number of colleges and universities that required that booster dose for healthy young people to get back on campus, which I think was just wrong.
Yeah, and you made the point in your column that those the doses they already have are sufficient to protect against severe disease, especially in young people who are the ones on campus, right?
Right, which is the goal. I think we've seen a little bit of mission creep. The initial mission was to flatten the curve, keep people out of the hospital so that the medical community could function again. But then we sort of crept away to trying to prevent mild illness, which is not something you're going to do for very long. And I think that was the thinking behind some of these college campus requirements, which is here you have people living together in dormitories. It's a sort of a ripe situation for transmission. But to try and prevent mild disease for any length of time is just not a winning strategy.
I think also in some institutions, they're probably wondering if the booster would stop transmission as well. You have any thoughts about that?
Right. No, same thing. I mean, it's this, these are short incubation period mucosal infections. That's just not going to happen.
The other aspect, which we talked about in my virology class, is that not everyone on campus is young, right? There are older faculty and administrators, and then many people go home to having older people in their families. And so there was some consideration about protecting them as well.
Right. By which, therefore, they should be vaccinated.
That's right.
And if they're really worried, then wear a mask whenever feasible. So I think trying to ask one person to protect another, I think isn't fair. I think you should if you're asking someone to get a biological, which has a positive effect and therefore can always have at some level a negative effect, you have to make sure that person benefits.
So today, as far as you know, are there any mandates left in the U.S.?
I don't think so. I mean, our hospital, for example, even when in September of last year, there was a recommendation by the CDC for everyone to get a booster dose, we actually did not require that for people in our hospital, for the staff.
So I don't remember where it was, but very recently I went to a meeting and I had to show proof of vaccination. And so if I hadn't been vaccinated, I would have had to gotten vaccinated. It might have been at a meeting in Switzerland I went to. I just don't I was trying to figure it out this morning, but I couldn't remember. But there used to be some mandates for travel, especially re-entry in the U.S. You had to even have a negative test, right?
Right, and that's gone, as it should be. I mean, we have about 96% population immunity at this point from either natural infection or vaccination or both, and that's why you're seeing a dramatic decline in hospitalizations and deaths from this virus. So I think we're winning. I know on TWIV, you spend a lot of time reasonably trying to define what pandemic means, but I think if you use sort of a more practical definition of changing the way we live, work, or play, I think this pandemic's over.
So moving forward, we're going to have new people are going to be born, new babies are going to be born, and they will not have been vaccinated. And so it will not be required that they get vaccinated, correct?
I don't think so. I mean, I think I would be surprised if there were mandates for children to get a COVID vaccine to enter school. That would surprise me. It is certainly the least vaccinated group. And I think you should get vaccinated. I'm now a proud grandfather of a 3-month-old. And if my son listens to me and my daughter-in-law, when that child turns 6 months of age, I think she should get vaccinated because she's not been exposed yet. And children certainly can suffer this disease. There's been more than 1,700 deaths in children less than 18 years of age. And they are fully susceptible by 6 months of age. Presumably the mother has been vaccinated or naturally infected or both, and she will then passively transfer antibodies to that baby, which will largely be gone by 6 months. So that is a fully susceptible person for a virus that is definitely going to be with us for decades, if not longer.
And so it's a similar policy for influenza virus. They're not mandated, and it's up to you to get good advice from your doctor to get vaccinated, correct?
No, that's an interesting analogy. I mean, our hospital, for example, mandates a flu vaccine. I mean, you have to get your flu vaccine every year to work at our hospital. We're not going to do that with COVID. And I think the difference is that it really is a strain-specific phenomenon. I mean, if you're not vaccinated and then you're exposed to influenza, you are at higher risk of severe disease. Whereas with COVID, SARS-CoV-2, because the T cells are important in protecting against severe disease, and those T cell epitopes are largely conserved, you still are protected against severe disease. I mean, I would argue that my natural infection in May of last year, which followed 3 doses of vaccine, will probably protect me against severe disease for years and years.
I just remembered that my faculty appointment is at the Medical School of Columbia, and I have to get a flu vaccine if I'm going to walk through any of the buildings with patients in them, right? And so I get a little sticker on my ID, and if I don't have a sticker, I think I have to wear a mask. instead of getting vaccinated.
That's the hospital next to ours, which is the adult hospital. The hospital of the University of Pennsylvania does exactly that. They make you wear a mask, which is sort of like the scarlet letter of saying, I didn't get a flu vaccine.
So let's just end by talking about which vaccines are mandated, say for school, getting into school, and why that's the case, and why is it different from COVID and flu?
Right. So the CDC makes recommendations about what vaccines should be given to children at various ages, but they don't mandate vaccines. That all occurs at the state or local level, and it's different. I mean, there are some states that mandate, say, the whooping cough vaccine, and others that don't, which largely has to do with sort of funding and internal priorities. So what I would say to parents trying to decide whether to get a vaccine or not, if the vaccine is recommended, get it. Don't assume that just because it's not mandated for school entry, that doesn't mean that it's not an important vaccine.
But there are some states where vaccines are mandated for school entry, correct?
For sure, most actually. It used to be that that initially all 50 states had mandates, at least had mandates. And then there was born in the sort of the 1970s religious exemptions to vaccines, and then that followed. What followed that was philosophical exemptions to vaccines. But so those were opt-outs.
Right.
More recently, you're starting to see sort of pushback in the other direction. Now there are 5 states or so that do not have either philosophical or religious exemptions. So you have to be vaccinated unless you want to homeschool your child.
And there are also medical exemptions, correct?
Right. All 50 states have medical exemptions, of course.
And in some cases, those are justified, right?
Of course. Absolutely. Yeah. A child could be allergic to a specific component of the vaccine. Yes.
All right. And so some of the vaccines that are mandated for school entry include the polio vaccine, right? Measles, mumps, rubella. Why do we do that as compared to flu or COVID vaccines?
Well, so again, I would argue if parents looked at the data, we wouldn't need to mandate vaccines at all. I think the birth of this actually came in the 1970s with measles epidemics. There were tens of thousands of cases of measles and hundreds of hospitalizations and the occasional death. And with that, although school mandates had been on the books for decades, that was when they started to enforce school mandates. It happened in Los Angeles, Detroit, Hawaii. There were a number of outbreaks. And what you found is that when you mandated, say, especially the measles vaccine, which is largely spread among young children, you basically stopped those epidemics. Because it's in school that often these viruses are transmitted. So that was the birth of school mandates, or at least that was the birth of enforcing school mandates.
Is it fair or correct to say that if a child got polio virus infection or measles, the outcome would be in general more severe than COVID?
Sure, I think so. I mean, polio would cause, in the 1950s, as many as 50,000 children to be paralyzed, as many as 1,500 to die. I mean, that was a most feared disease. I mean, I am a child of the 1950s, and I was in a polio ward for about 6 weeks when I was 5 years old. I didn't have polio. I had a failed operation on my right foot, but I remember polio. I remember children in iron lungs. I remember those Sister Kenny hot packs, which were intensely hot and caused children to scream. And this was back in the 1950s when you had 1 visiting hour a week for your parents and you didn't have like iPads or therapy dogs. I mean, you were just basically lying there for a week, hoping your parents would come save you. It was literally hell on earth.
Yeah, I just want people to get a sense of why we still mandate certain vaccines against certain diseases and not COVID or influenza, because those others were really bad.
Yes, absolutely. I mean, my parents were scared to death of polio. We all were. Yeah,
I have seen many articles which talk about the polio hysteria of the time, right? Parents feared their children being paralyzed for their entire lives, right?
It was the birth of summer camps. I mean, this sort of summer camps up in Maine or upstate New York to get children out of the city so that they then were perceived as being less likely to suffer. My father, I remember, was at a camp in New York. It was called Idlewild, and there was a polio outbreak in that camp, and a number of children were paralyzed in his camp. Yeah. And he gets up the next morning for revelry, and he looks across the lake there, and the person who was the camp director actually had taken his own life by hanging himself, having experienced that. This was an awful, awful disease.
Idlewild, that used to be the name of JFK Airport. I don't know if you remember that.
I do.
Idlewild Airport. All right, you can find Paul Offit at Beyond the Noise on Substack. We'll put a link to his posts in the show notes. That's Beyond the Noise #3 with Dr. Paul Offit. Thanks, Paul.
Thanks, Vincent.